I'm Dr. Alan Muskett from Billings Plastic Surgery, and I'm here with Tricia Kelly, who's a registered nurse who works here at Billings Plastic Surgery as well. And what we're here today is to talk to you about breast augmentation. Now, you see a lot of advertising for breast augmentation, a lot of fancy websites, but we would like to give you today kind of a real view of what breast augmentation is like, what it's for, what to expect, and really pretty much everything you need to know about it. So I'm going to start off first, and since you're more likely to believe her than me, I'm going to ask Tricia, first of all, who does consider breast augmentation?
Well, of course, there's a range of people that consider breast augmentation, but within our demographic, Montana, probably the majority of women that that come to our facility to consult on breast augmentation are women in their 30s, just had a couple kids, and want to have their bodies back, have the volume replaced that they've lost with pregnancy and breastfeeding and that type of thing.
And there's also another group of women who just really never have much breast development. You know, there's sometimes we'll see younger patients where they grew up and simply didn't have development of their breasts. And I would say for the most part, you can correct me if I'm wrong, that most of the patients we're seeing are not average sized women who want to be huge. I think there's a real misconception that we get from television or shows like Baywatch or posters or people that breast augmentation means that you're going to end up with huge breasts. I think for the most part our patients are people who've had loss of volume due to pregnancy, have never had breast development, who are just looking to have normal proportion for their figure. What is your feeling about that?
We're not Las Vegas, we're not Florida, we're not California. We're people that are very reasonable and want to just have normal proportion, body proportion, and feel more feminine or have it replaced that was lost.
Now, would you say of our patients who've had breast augmentation, there's obviously thousands of them running out there, can you tell they've had breast augmentation?
No. Typically, no. I mean, you really have to outstretch your volume and come out of proportion of your body to really be able to say that person has had a breast augmentation. Kind of our goal in breast augmentation here is to make it very natural and have it fit your body and not go out of proportion, to where it is very natural and no one can say, hey, you've had a breast augmentation. Absolutely.
I think one of the things too with breast augmentation is that we have to consider that you are adding some weight to your body, to your skeleton, and it doesn't take a lot of weight necessarily before you can start feeling it in your neck and shoulders. So the very large implants that you see in say television shows, or you see in maybe actresses or public figures, very often those can put strain on the neck and shoulders. So what we strive for here is to give you what you want in terms of volume, in terms of the look, but not cause problems with your neck or shoulders over a long period of time, and this really can occur. All right, we'll look forward to seeing you at Billings Plastic Surgery.